him for quite some time, and he is just a wonderful doctor and a wonderful man. Dr. Timothy Shawn Caudill is a general internal medicine primary care doctor. He's been practicing in UK for over 35 years. He knows a thing or two. He has awards that I couldn't even try to list. It's a mile long. And he is just a gem in our center. He's been recognized as a best doctor by multiple organizations. He specializes in primary care and geriatric medicine. And his leadership and expertise and compassion for everyone that he works with it just stands out just on a daily basis. So he's a tremendous resource for his patients, all of the research volunteers, and all of us at Sanders Brown. So please join me in welcoming Dr. Timothy Shawn Caudill.
I saw that, yeah. Beautiful. So, let's do that. Yeah. All right. Well, all that being said, I'm just a normal guy, so don't take all that seriously. But I have the one thing that is accurate. I have been working as a general internal medicine primary care doc for over 35. It's going on 40 years, frankly. So that's a lot of experience with the aging process, and part of my practice has been teaching. I teach students and medical students and residents, and occasionally we have fellows, and also some educational research. So a lot of academic stuff, but the clinical part has always been the best part, in my opinion. Getting to know people, long-term relationships with my patients, and watching them age over time. And I've learned a lot from that, and that experience. And I've had to learn a lot of how to manage the aging process, and also I've learned a little bit, maybe more than a little bit, on how to prevent what we call unsuccessful aging. Successful aging versus unsuccessful. It's not defined terribly well, but the goal of this talk is to kind of help folks understand some of the things that you can do even now, it's never too late, to improve the aging process as you walk through it through the remaining years. And the other thing to think about too is what not to do, and that's the hard part for a lot of us, because some things we've been doing all our lives, and it's hard to change those behaviors. So that's sort of the introduction I'm going to have. Let's see if I push the right button. So, nope, that's the wrong button. There we go. Okay, so in college medicine, we always have to have learning objectives, so you don't have to have these objectives met by the end of the talk, but the goal is to do that. We're going to look at, I can look down here, what is normal aging? We're all aging, and what's normal, what's a red light, or what's something we need to, red flag, something we need to worry a little bit about. We're also going to look at the impact of lifestyle on aging. A lot of folks don't realize the aging process depends a lot on how you live your life, really from the time you're born until now, and we'll look at some aspects of that, and what kind of preventive care is important to prevent things from happening that delay or make the aging process less successful. A lot of tech here. So this is a brain talk. I'm a general internist, not a neurologist, not a brain specialist. About 3-4 years ago, Dr. Jaika was looking for someone to come help him with a lot of the clinical trials. They have examinations that have to be regular. I've examined several of you folks. I've recognized some faces. And basically, I'm glad I took that job. It's been a wonderful experience. It's a great place to work. But it's all focused on brain, and more recently, the aspect has expanded to, okay, what involves the healthy brain? What keeps your brain healthy? Well, the key point here is the brain doesn't exist in isolation. One of the things about being a primary care doc is we look at the whole person, the whole body, all the organ systems and how they interact, what they do to each other, and how they support each other. And the brain is no different than any other body system. They're very interdependent. And all the other body systems that contribute to brain health need to be healthy as well. So as we go through life, I know we focus a lot on brain health, but the rest of the body has to be healthy as well. And there are some normal changes with aging, as we've all experienced, and I'm doing the same. Memory becomes slower, little problems with memory. Our physical health is a big part of the aging process that is affecting our ability to do things, come here, go there. And our mental health actually changes. And there are some normal changes that are okay, but you want to delay the normality as long as possible so you can actually function as long as you can healthfully in later years in life. And again, lifestyle, you'll see this line a lot. Lifestyle directly affects the aging brain. So let's look a little bit about normal aging. I'm going to try to run through these slides quickly because I want to leave time for questions at the end. Memory or cognitive function is, and everybody who's 60 or older knows this, it gets slow. It takes longer to do things. Your attention span decreases. Difficulty multitasking. I don't think multitasking is a thing. Multitasking is really changing focus quickly and going to different tasks, and that's harder to do as we age. I'm no longer able to do that. Not that I was very good at it in the first place. Learning things takes longer and takes more work. Forgetfulness occurs, which is really annoying. Name forgetting, word on the tip of my tongue, can't figure out the right word, and where'd I leave my keys, my glasses, that kind of stuff. That's all kind of common and pretty normal. And in order to kind of keep that stuff from getting worse, the brain needs stimulation. And you can't exercise your brain in the gym, but you can do some things to keep your brain sort of stimulated. And learning new skills, such as learning how to play an instrument. I'm going to retire in a few years, and I'm thinking I might relearn how to play the piano. I don't know, just something to think about. Hobbies, art, all kinds of different things. Volunteering, spending more time in community, engaging with other people, coming to things like this. This is learning new stuff. Maybe not new stuff to you guys, but this is a good way to exercise your brain. And again, healthy lifestyle. One thing you need to also be careful of is a lot of times we don't notice some of these things, and we'll have a new ache or a new cough or a new memory thing, and we won't notice, but maybe our daughter or son or spouse or someone will say, hey, that's not right, and you're like, oh, I didn't notice. It's good to get those things checked out. Sometimes these are early signs of things that can be intervened on quickly and effectively before they get out of hand. So just don't blow off symptoms. See your doc, get an evaluation, maybe some testing, and treatment if they find something. Physical health is a big part of the aging process too. I'm not telling you anything new. I wake up every morning with aches and pains. Like, what the heck? Oh yeah, I cleaned out my car yesterday. Well, that didn't used to bother me. Well, now it does. So slowing down with aging in the musculoskeletal system and the cardiovascular system are things we all experience as well. And just some of those functions are listed here. The pumping function of the heart decreases, just the aging process. You don't have to have had a heart attack or any major medical conditions. It just gets less efficient as we age. Same with the blood vessels, they stiffen. Blood flow is tougher to get to the cells that need the nutrients and the oxygen. Lung capacity decreases. We don't process oxygen as effectively, and it takes more rapid breathing sometimes to maintain exercise or activity. Musculoskeletal is a big issue. Once we get to a certain point, we lose muscle mass all through our lives, and as we age, it accelerates. And getting that muscle mass back is very difficult. So maintaining muscle mass is pretty important. Bone density increases, joints stiffen, tendons and ligaments get stiff and shorten, and that leaves us all feeling achy and tired, and increases the risk of falls and fractures. So those are issues that need to be intervened with and prevented if possible. Again, healthy lifestyle. We'll get to the details of how to do that next. You got to keep moving. And if you develop a new symptom, don't ignore it. An ache or a pain may be something that's just an ache or a pain, but it may be something more serious that needs to have an evaluation and some kind of treatment to prevent it from getting worse. I mean, that's the bottom line is if your doc says, yep, it's okay, how about some physical therapy? Do it. Physical therapy is magical to old bodies like ours. I've had physical therapy a couple of times and totally cured my symptoms. I was so impressed. That's one of my main prescriptions to my patients is physical therapy. So don't ignore that if your doctor recommends it. What about mental health? Well, mental health is aging as well, and basically that manifests in decreased tolerance for stress. And I am working my best to try not to be a grumpy old man. But I tell you what, you read the news, it's bad. I don't read the news anymore. I love my grandkids to death, but they are very noisy. And after a while, I'm like, I can't take it anymore. We're more prone to depression, anxiety, and that kind of stuff. And things that aggravate that are isolation. The thing we want to do is try to avoid it, and we are at risk of just not going out and experiencing anything just to prevent the stress. That's not a good thing. One thing we learned from the pandemic, as we age, isolation does no good for most anything, let alone the brain. So staying out there and engaging and tolerating the stress, you can limit it. You don't have to be there all day with your grandkids, but a couple hours at a time is fine. If you have hearing loss or visual loss, get it corrected, because those stimulations that come in, those see, I'm having a moment. Well, you get it. If you're not getting that input, the brain doesn't get stimulated, and so you need to have at least some correction of those senses. And an active lifestyle. Actually, there's a lot of studies in all age groups that exercise decreases depression and anxiety symptoms. So being fit and healthy actually helps your mental health as well as your physical health. And sleep is incredibly important. You got to have enough hours of sleep, but also good quality sleep. That's one of the major factors, I think, in a lot of people's feeling bad is they just don't sleep well. So what do you do to try to counter that? This thing keeps flipping up. Spend more time in community, do this kind of stuff, go to whatever, go to the senior center, go out with family, go shopping, go to church, whatever, ring your chimes, get out there and be with people. If you have a mental health symptom, don't ignore it. And a lot of times you won't notice it, but someone else will, and they'll say, hey, you seem a little down. And you think, well, maybe I ought to get that checked out. But don't ignore it. Get it treated. Get your vision and hearing checked. And try to reduce stress. It's impossible to eliminate it, but trying to avoid avoidable stresses and trying to manage it with some healthy lifestyle stuff we'll go over can be helpful as well. And again, don't ignore the symptoms. Get it checked out. All right, what is a healthy lifestyle? That's easier said than done. It turns out lifestyle accounts for the majority of aging changes. Genetics is only about 25% impact. The rest is lifestyle. I sort of put these into 4 different categories: healthy activity, healthy diet, healthy habits, and healthy relationships. I have learned to avoid words like exercise. It sounds painful, it's sweaty, it's gyms, it's smelly. Don't want to exercise. Barrier, you got to go out of the house. Healthy activity sounds positive, right? Go out and do things, take a walk, whatever. I avoid diet as well, and I should say healthy eating. Healthy eating behaviors is more positive than a diet. Sounds like starvation, deprivation. You got to do these weird diets that don't work. So healthy activity, healthy eating are 2 of the major factors here. And the healthy habits and healthy relationships. So let's look at those things individually. So there's your little, I'm a visual learner. I like this because regular activity, not exercise. Adopt a healthy diet, take time to unwind, that's the stress part, and get some good sleep. Okay, what is healthy activity? I gotta watch my time, so one thing I'm not gonna do is run into the lunch hour. I know better. Anytime you're the speaker before lunch, you have to finish on time. So I'm gonna parse my words a little bit. And my wife keeps saying, I see I'm rambling now. My wife, she'll see me do a talk, she'll say, stick to the script. Don't ramble. You're burning up a lot of time rambling. Okay, I'm going to stick to the script. So anyways, keep moving. And what do you do to move? Well, there's 3 aspects of physical health. There's a cardiovascular fitness, aerobic, in other words. There's a musculoskeletal fitness, and that's like resistance training, not weightlifting necessarily, but something to help build the muscles. And there's joint fitness, flexibility, and that would be stuff like yoga, stretching, that kind of thing. And on the slides, these slides will be available on some site someplace, I think, if you want to look at these again. Aerobic activities can be a lot of things. It doesn't have to be jogging or running. It doesn't have to be heavy-duty biking. You can basically walk in a swimming pool or do a brisk walk, 30-minute walk after dinner every night outside. Gardening and yard work counts. Housework, oddly enough, is a great activity. And yard work, I mean, a lot of my neighbors, I still do my own yard. I mow it, I put down mulch. I got neighbors younger than me hiring it out. I'm like, guys, come on, get out here and work out. So anyways, just keep moving. And the goal is really to get the heart rate up to at least 120 beats per minute. And with a Fitbit, or you can just kind of do some walking and stop and take a quick check, you can see if you're walking fast enough. And unfortunately, my patients will tell me, yeah, I walk my dog every day. I'm like, you walk your dog and that's your fitness? Walk, pee, walk, sniff, walk, pee. No, that's not good enough. You gotta be moving. You gotta sweat a little bit, get a little shorter breath, and do that at least 4 times a week. And for muscle fitness, another thing we do is we eat less protein. We don't even realize it sometimes, but it's hard to get protein. I've tried to get 75 to 100 grams a day of protein in our diet. It's very good target to try to maintain muscle mass. That's not easy to do. If you ever try to do that and find out you're eating like 40, 50 grams a day, how am I going to add more protein? Well, you think meat, of course, that's got protein. You don't have to use meat though. Eggs, dairy, cheese, yogurt. I had to learn to like yogurt. Not a favorite, but boy, they make some really tasty ones that are low fat and sugar free. And high protein. Carb Master from Kroger's. They didn't pay me to say that. That's a great yogurt. It's got like 9 grams of protein. And protein powders are okay. You just have to watch and not get protein powders with a lot of additives that are ultra processed. And you also have to look for the sugar content because a lot of them are sweetened. But with a protein drink, you can get 30 grams of protein in one sitting. You're halfway there. So look for opportunities to increase protein intake in your diet. Also, calcium is important. Weight-bearing activities. Walking and jogging actually are weight-bearing activities. Weightlifting is fine, but just any kind of resistance. Physical therapists will tell you how to do the rubber band thing and doing something that has some resistance to do. And regular calisthenics, oddly enough, is a pretty good way. The old-fashioned, I won't demonstrate, jumping jacks and push-ups. Those are good fitness, muscle resistance exercises to do. And you don't have to do a lot of it, just maybe 20 minutes at a time, and it's okay to rest between exercises at least 2 times a week, 2 days a week. And joint fitness, I think this is the most important thing for me. I have a stretching thing that I do about 4 days a week, usually after I do my aerobic stuff. And if I don't do that, I know in 2 days, I am tight all over. And I'll just go through my stretch thing, and it's gone. It's amazing how much stretching does to make me feel less aches and pains. And again, do that 4 or 5 days a week. So the challenge is when to do that. Now I know y'all are busy, but if you can schedule other stuff in your activity or in your daily activity, schedule this, because this is going to be a bigger payoff than watching your favorite TV show or whatever. So these are very important things to make you feel better and also keep your brain healthy as time goes by. Healthy eating, that's a bigger challenge. Okay, I'm from Ashland. I'm from Eastern Kentucky. And yes, I was raised on bacon grease and all the vegetables. If you eat vegetables without bacon grease, to me they taste like dirt. I'm sorry. I am just, and I don't know, my parents, they died last year. They were 90, and I don't know how they lived that long because my dad he cooked the last several years. He put bacon grease in everything. They fried a lot of stuff. It's not healthy to do that kind of thing. So it's better to try to find healthier ways of preparing food as well as healthier food choices. Some proteins that are healthy. Beans, another thing. It has a lot of protein in eggs, yogurt. I've already mentioned those things. Avoiding processed meats. There's more and more coming out about ultra-processed or processed foods. And if you, the rule of thumb, if you look at ingredients on a can or a box or a package, and it has foreign language on it, ingredients-wise, it's probably ultra-processed. If it has green beans, water, salt, that's pretty pure stuff. Frozen vegetables and fruits actually have less ultra-processed stuff in it, but read the packaging. Somehow I think we're going to find out that ultra-processing is a big part of our diabetes and other health problems. Fresh is always better. Fresh fruits and vegetables obviously are much tastier too. And healthy preparation, again, trying not to use breaded stuff on your vegetables. Went to the fair some years ago and discovered deep fried Oreos. Have you ever had a deep fried, or Twinkies? They put breading on Oreos and deep fry them. I mean, oh my gosh. That just lit up in my brain. The dopamine just went crazy when I had that. So, okay, I can't go there anymore. Be sure and prepare your stuff very well, and limiting eating out. As we've aged, my kids are out of the house. We eat out a lot. We eat out probably 3-4 days a week. My wife used to be she still is a wonderful cook. That's a big bad slip. She hates to cook. She hates it. She says it's way too much work. I spend days preparing and shopping and da-da-da. We sit down and preparing and cooking it. We sit down and we're done in 10 minutes. And I'm like, well, I'll clean up. Well, that's not a good exchange. So we eat out a lot. There are ways of eating out healthfully, though. Basically, you can look at the menu and say, okay, I could have French fries, or I could have a baked potato, or I could have French fries, or I could have fruit. Going to Chick-fil-A, their fruit cup is awesome. Best fruit in the fast food industry. Chick-fil-A food, the chicken, unbreaded chicken, fruit cup, and a non-diet water. Water's a great drink, by the way. And trying to choose healthy stuff when you eat out, you can still do that. It's okay to have a treat every once in a while. I mean, you got to have some fun in life, but trying to eat healthfully most of the time. We also overestimate the amount of calories we need per day and underestimate the amount of calories we actually eat per day. I got a little app on my phone, and it's MyFitnessPal. I started putting stuff in it. I was shocked. 2,200 calories a day. No wonder I can't lose weight. I've got this thing growing around my waist. So I actually cut it back to 1,800, and I can look at the protein content, and also once I'm eating my first 2 meals a day, I know how much I've got left over. And if I have a big lunch, guess what? I got to have a smaller supper. And so it kind of helps me balance that out. And 1,800 calories a day is plenty for the amount of activity most of us participate in. Maintaining a healthy weight is important. Healthy snacks. Fruits are a great snack. They're sweet, they're crunchy, they're cold. Not like ice cream, but they are a good way to snack and avoid extra calories. Again, healthy beverages, water. Coffee turns out to be a pretty healthy thing. I don't know if you've read in the news, but coffee drinkers actually live longer than people who don't drink coffee. So go ahead and drink up the cup of coffee. But try not to put a lot of sugar or cream, and avoid Starbucks. I'm sorry, Starbucks, but one Starbucks drink has 300 to 500 calories. That's a meal right there. And alcohol, they go back and forth with recommendations, but try to limit that to no more than 4 or 5 a week, or one a day probably is safe for most of us. Healthy habits, again, avoiding stress when you can, and managing unavoidable stress is helpful. Limit your exposure if you can. Take a break from the news, for instance. Accept help if you need it. Some people want to do everything themselves. Well, you've got people offering to help you. That's less stressful, so take them up on it. They may not do it the right way, but at least you can do less and have less stress. And again, sleep is important. 8 to 9 hours a night is optimal, and trying to get good sleep with deep sleep and feeling rested the next day is the goal there. If you're not sleeping well, get that checked out. You might have sleep apnea or some other problem causing you to be a poor sleeper. And healthy relationships, again, we found out from the pandemic especially, we don't do well in isolation. We need community. We are community animals. It can be family, friends, community organizations, anything that gets you out and about. Healthy relationships reduce isolation, reduce stress, and reduce mental health problems. And there's a lot of ways you can do that. Spending time with friends and family, and sometimes you have to be actively going after that kind of thing. I have a few guy friends, but Guys, we never plan anything. So it's like, okay, I need to call my friend and go golfing or go to lunch or whatever. And he says the same, and of course we put it off. But reach out and do that kind of stuff. Volunteering, doing some part-time work can be helpful, but just stay engaged. That's important, and important to your mental and your brain health. So what about preventive care? I'm a general internist, and we are all about prevention. We have recommendations for cancer screening, for all that kind of stuff. And it starts at age 40 now, but it's never too late to see what prevention is helpful, even if I'm 80. Let's see what I need to have done to prevent bad stuff. So what do? Well, the best prevention is a healthy lifestyle. I told you you'd see that again. If you have cardiovascular risk factors, treat them or reduce them. Don't smoke. Treat your blood pressure, blood sugar, know your numbers, and follow your doctor's advice. I know the internet has a lot of stuff out there. Let me show you. I brought my prop. I have patients come in all the time and say, well, have you seen this on the internet? And I'm like, what? And they'll tell me this wild-haired story. I'm like, where did you see that? On the internet. That's why I stopped my diabetes medicines. I'm like, excuse me? That's why your hemoglobin A1C is 12 today? It was 8 or 6 the last time I saw you. So I'm fighting that a lot. Now, the internet has good information, don't get me wrong. But you got to be discretionary as to, it's like taking advice from friends. You know who gives good advice and who gives not so good advice. The internet's the same way. And my son got me this, during the pandemic, it was rampant. And he got me this mug. Please do not confuse your Google search with my medical degree. And I take that. I take that to work on my clinic days, and I carry it into the room sometimes. We're not supposed to take drinks into the room, but I select patients, so I take that in. That's right. But yeah, you can actually find good information, but you have to, and anytime you find information, don't just act on it, check with your doc. We keep up with this stuff. We read the scientific literature. We go to CME conferences. We try to keep up with the latest and greatest. And you're going to get a lot of information that's very confusing out there, but check it out. So we still recommend cancer screening based on different risk factors, lifestyle screening. This is, some of you, a lot of you probably had the Medicare Wellness exam. That's something that came out, 10, 15 years ago. There are a set of questions related to aging that all Medicare patients are recommended to have us ask, and they are these kind of things. Cancer screening, obviously, blood pressure, blood sugar, all the usual medical stuff. But what about your vision? Is it okay? What about your hearing? What about your depression score? What about anxiety? What about your sleep? Do you have an advance directive? That's the last question on the form, which is kind of. And don't forget about your teeth. Dental care is very important. My mom decided she didn't want to go to the dentist anymore when she was like 87, and then suddenly, within 2 years, she's got stuff. I said, go back to the dentist, so she got them fixed. Finally, know your medications. Polypharmacy is a term that means if you take more than 5 medications a day, that puts you at risk of problems. So review all your medications and non-prescription stuff. The supplements are important too, because supplements interact in some ways with your organ systems with the other medications. So it's good to know and let your doc know what medications you're putting in your mouth every day. Not sit on the shelf and you forgot to take them or whatever. Take them as prescribed, obviously, and anything else that you're taking. For brain health, I've seen ads for Prevagen. Some years ago, my mom had dementia, probably about 7 or 8 years until she died. And 3 or 4 years into it, my dad said, have you heard about Prevagen? Because I was working at the aging center. I said, no. And he goes, well, from what I've read, it's good stuff. For your brain, for your memory, you think, we hope, Mom. I'm like, let me read about it. And it's like, it's some kind of, I don't know, it's probably what's in the capsule. It could be sawdust for all I know. I said, well, how much does it cost? $40 a month. I'm like, I think if that was a valuable agent for memory, we'd be using it at the aging center. So no, don't waste your money on that. The advertisements look very good. And sometimes you're desperate. You're like, I got to have something, so I'm going to try this. As long as it does no harm other than your pocketbook, fine, go ahead and take it. But we don't know that. Most of these supplements are really not tested well at all, usually. And we don't know if they're safe. We don't know if they're effective. We do know they're costly. So save your money and try to minimize that. And make sure your dosing is accurate. As we age, we don't clear medicines from our bodies as readily as we used to. Our kidneys get a little weak, our liver gets a little weak, our GI tract doesn't absorb the same. So as we age, we tend to collect more medications as well. It's a good idea to, and I try to do this when I see a long list on my patient's med list, I look at all those medicines. Are they still getting a benefit that's significant out of this? What about the risk of them continuing to take it? And is the dose too high because they've aged into a point where they don't need as high a dose and may need to adjust those doses? Or try to knock off some of the pills that aren't really effective anymore. It saves you money, saves you side effects, and it's also just unnecessary. So be sure and check with your doc on your med list to make sure you still need all the stuff you're taking. I think that's all. I did it. So, we have a Q&A. We got time. I told you I was going to finish in 30 minutes.
Great, that was wonderful. Give a hand for Dr. Caudill.
Good job. So, open for questions.
You know, when he talks, people listen. That's Dr. Caudill.
Well,
Did you have time for some questions? Oh, sorry.
I have hearing aids, so it's hard for me to hear, so you're going to need to probably translate some of these questions.
You may be the only person in the world that has ever said they have a hard time hearing me. I might be used about
I can't hear Boo without me.
All right, we do have time for question and answers. So does anybody have a question they'd like to ask? Yes, over here. What role do vitamins play?
Vitamins, great question. There's actually been a recent study that came out on just multivitamins, and they really haven't been found to be very impactful on health as long as you're eating a regular, sort of normal diet. And the American diet has plenty of nutrients in it. There are some preliminary findings that it might be beneficial as we age, because, especially after age 80, because we're not eating as much, and the foods we get, we may not have as much of a variety. A lot of the foods we eat are fortified in this country, and they have vitamin D, they have the B vitamins. A lot of that's already in our foods, so it doesn't hurt anything. That's the good news. If you want to take a vitamin, go crazy. And they're expensive, I've seen them. But it may or may not be that beneficial, but it won't hurt anything, except maybe your pocketbook. So, good question.
And we've got a question over here.
Yeah.
What about people who don't drink? What about coffee? And what about the people that don't like to drink coffee? Are there other liquids?
Well, the problem with coffee, well, not the problem, the thing about coffee is, and this is large population studies. So when they do these large population studies, they're not randomized, they're not controlled, but they just said, let's look at coffee drinkers through, this is I think the nurses study or whatever, through 40 years or 30 years of this data collection, and let's look at people who don't drink any coffee. And it turns out the people who drank coffee lived longer. Nobody really knows why. It doesn't seem to work with decaf, unfortunately. So caffeine probably plays a role. But there's also other stuff in coffee, other chemicals. There may be some anti-inflammatory type stuff. One of the oxygen radical thing, free radicals. There may be something that blocks free radicals. Nobody really is sure because it really hasn't been studied. Tea is different than coffee, so it probably isn't as good. Yeah, unfortunately, if you don't like coffee, that's not a bad thing, but it's, I think it's what I use that information for is people are worried about drinking too much coffee. And the study looking at had up to 4 cups a day. That's quite a bit of coffee. That's like at least 2 of these, right? These are 16 ounces, yeah. And I have probably 3 of them a day. The only time you have to worry about drinking too much coffee really is if you, and some guys will understand this, prostate issues make you pee more, so the more you drink, the more you're gonna pee. And if you have rhythm problems with your heart, might aggravate that, fast rhythms. So, and unfortunately, there's not really a good substitute for coffee. So.
At what point can you say no to a cochlear implant?
Oh boy. I have a friend who's 90 or so, I think. Our parish nurse is here. She's shaking her head. And he got one. And I don't think there's an age limit. There may be other limitations, but I will tell you about hearing aids. They take a long time to get used to. I've had well, not these, but I've had hearing aids for going on 8 years now. And I would say in the last year or so, I finally got used to them because they make everything louder. And that's very difficult when you haven't been exposed to that loud noise. It's hard to get used to that. Eventually, your brain kind of starts toning that out. And the older you get, the harder it is to adapt. And my audiologist told me that. The other thing, too, is it's not just not hearing the sounds, but it's also understanding the words. And the understanding process can deteriorate and be hard to reverse, too. So the longer you wait, the less you'll be able to recover that hearing loss from the lack of being able to understand the actual words. So the earlier the better. It's never too late, though, I'd say. And, people say, well, I've got arthritis, I got heart failure, I can't exercise. I say, well, don't exercise. Just sit in a chair and do this. Do something. Just move around. Chair yoga, chair aerobics, that kind of stuff. My parents were in assisted living for about 2 or 3 years before they died, and they had an exercise group that met every week. And would they participate? No. So finally I got my dad, who was pretty functional up until he died. I said, okay, he was using a rollator. He was almost 90 at the time. We're using a rollator. And he said, how am I I'm getting wobbly. I'm going to say, well, walk around the assisted care place with a walker with your rollator, and when you get tired, sit down. Do that 10, 15 minutes a day. And so he did laps, and he recovered a lot of his function and his balance. So, yes, I think I recognize you.
Dr. Caudill, I just wonder, what's your reaction to my grandparents, great-grandparents, who lived out in the country, did farming, never went to a doctor,
Okay.
took no medicine, drank no coffee, drank no tea, they just lived off the land.
And drank water.
I just wonder what kind of reaction and comment might you make about these people who lived up into their 80s and yet had no contact with any kind of medicine or medical men?
Yeah, I got two points to make on that. Number one, they were lucky. And luck meaning they had a lifestyle that was somewhat protective, being in a rural kind of setting without a lot of exposure to probably pollution, probably bad food, this ultra-processed food, that kind of thing. Like I said, my parents lived to be 90 and they fried everything. They didn't worry too much about their eating habits, but they didn't eat a lot. They were normal weight. My mom gained a little weight and had some diabetes, and the activity. My dad worked until he was 83, and part of his job was walking the lines of telephone company poles and such and drawing maps. And he'd walk 5-6 miles a day on some days in his 80s. I'm convinced that kept him going because he smoked until he died, which I don't know, I can't explain that, but some of it, and if you look at, they were exceptions probably. You look at most 90-year-olds, they're dead. So, some people just have that ability to live longer, and the lifestyle does impact it, but the vast majority of us, lifestyle does make a bigger difference. In fact, one study I read said that 85% of no, wait, let me say this right. Up until your age 85, that's when your genes kick in. So if you have people in your family who've lived into their 85 and beyond, that means you've inherited good genes. Genes have less of a role to play until you hit that age. It's mainly your longevity after age 85 or so. I don't know if I answered your question, but.
Okay, I'm very close to 90 years.
Right.
Okay, my blood oxygen is dropping.
Blood oxygen, okay. And what was your, I thought you said your buttocks is dropping, I'm sorry. That's why I wanted to make sure. I'm hearing that, I'm like, well, that would have been a tough one to answer, frankly, but this is going to be easier. Say your blood oxygen level's dropping and.
Blood oxygen's dropping.
Yeah, what was your question about
What's
it?
the question? It's below 90. Should you worry about it dropping below 90?
Well, it depends. All my answers are going to be it depends. Is that when you're just resting, or is that after you exert yourself? Both. And are you symptomatic at all with that? Any shortness of air or anything like that? No. and being almost 90, you probably don't have any major heart or lung problems. I won't make it say anything about it. Again, the aging process, you're going to have some issues of everything dropping, buttocks included. I'll say, mine are still in pretty good shape, but I don't know. You know, not having known you but a few seconds, it's hard to kind of determine, but it's probably something that should be checked out. And it might be that you have just had less efficiency in being able to take, you know, efficient breaths to get the oxygenation up well enough. So I'd probably ask your actual doc about that. But congratulations to being almost 90 and here.
All right, we got one in the front.
For those of us that have trouble sleeping, my understanding is that a lot of the prescription sleep medications contribute or put you at a higher risk for dementia, Alzheimer's. And I was wondering, do you recommend supplements like magnesium, melatonin? If you've been checked out for everything else, and everything else is fine.
Right.
What can we still take for sleep?
Yeah, the prescription medications typically have been benzodiazepines like Valium and Xanax, and they are helpful for a night or two, but you develop tolerance and it doesn't work. And the over-the-counters have Benadryl and antihistamines, and they can affect memory over time as well. So taking anything like that daily is probably not a good idea. I really avoid, Ambien is a big one. Everybody likes Ambien. I try to avoid that as much as possible. And as you age, it can affect your memory, your functional. It doesn't cause dementia, I don't think, but it can affect your processing speed and things like that. And also increased risk of falls and confusion, just having delirious type episode. And I'm talking about 70, 80, beyond that age group. You probably wouldn't have any problem with that, I would guess. Now, one thing that's a non-pill way of helping with sleep, have you tried, and again, this is getting personal, if you don't want to answer, that's fine. There are some behavioral therapy kind of counseling that can help with this sort of, with chronic insomnia, let's say. CBT, it stands for something behavioral therapy. Yeah, cognitive. This is a cognitive talk, I should be honest. Cognitive behavior therapy. And we have some therapists, some counselors in our practice that I refer people to, and a lot of times that helps a lot. And they give you helpful hints on how to manage your racing thoughts when you're trying to go to sleep. Melatonin actually, it's a natural part of your brain. Melatonin actually kicks in and helps you fall asleep. So if you go on a regular sleep cycle, when you're sleeping, go to bed at the same time every night, that kind of thing, it conditions your brain to say, okay, it's 10:30, you're going to sleep at 11, melatonin's going to kick in and help you fall asleep. It does nothing for the waking up, can't go back to sleep though. So that's a tough one, yeah.
Okay.
CBT might be I don't know if you've tried that, but try that, yeah. Go ahead.
We've just got, I know there's so many more questions than we have time for, and if we promise not to log Dr.
Oh, I'm not going to, I'll be here, yeah, go on up.
Dr. Costin has a question over in the back. The creatinine buildup in the muscles. Creatine.
Oh, creatine is a supplement.
Yeah.
Okay, sure.
Creatine, one has the supplement.
Yes.
Does it help?
Yeah.
With the side
Yeah. That's
Does it
a.
help with exercising?
to rebuild muscles.
That's a.
Does it help with exercising to rebuild
Yes,
muscles?
that's an excellent question. And creatine is used extensively in the sporting world to build muscle mass and maintain stamina and things like that. It turns out it's probably the most studied supplement ever. And it has been shown, especially in younger folks, to rebuild muscle. Now, the way to use it as we age, and it's very safe. No problems at all. In fact, I started taking it about a year ago, and I feel like it's helped me. That's the only supplement I can recommend, though, because the rest of them are marginal. However, as we age, it's really, really difficult to increase muscle, but it can help with maintaining muscle mass as we age, and also helps with stamina in some studies. So it is a safe and effective way of helping with musculoskeletal health, yeah. And
All right, we got one last question. I'm so sorry, that's all we have time for. But like I said, Dr. Caudill will be around. You can talk to him later. One last question.
I'm a walker, and I do like to take medicines and atorvastatin. So I get my shot every 2 weeks. I've been on it 6 weeks. They also told me that atorvastatin would only hold my cholesterol where it was. I had 40% blood. And they said Repatha will actually dissolve or lower my cholesterol. Proof of that.
Is there any proof of that
Wow.
Repatha and cholesterol?
Repatha is an alternative to people who don't tolerate statins, and the cardiologists use it a lot. I have used it some. I'm not that up to date on cardiac medications, but I do know that the long-term studies looking at two of the statins, atorvastatin or rosuvastatin, do show a direct impact on longevity in people who have established cardiovascular disease. I use rosuvastatin because I got stents. That's a whole nother story. I don't know how that ever happened. But if a patient doesn't tolerate a statin, you can use Repatha. I'm not sure the long-term studies have come out yet that show it really makes a strong difference, but it is an alternative because the goal in the statin, if you start a statin, is to get your, they change it all the time, get your LDL, the bad cholesterol, down below 70. And the statins are very effective in doing that. And Repatha is very effective in doing it too. So I would defer to your cardiologist. I never tell anybody not to listen to their doctor, especially if I don't know you. But I think it's a reasonable alternative to statins, and I have used it in my patients. I just do know that the long-term studies are yet to be determined. As far as I know, that there could be some research. I don't follow that literature as closely, so there could be some studies that show it's just as good or better than statins. So. And I think if that was the case, the drug companies would be advertising heavily and detailing docs heavily on that. But hope that answers your question.
Thank you all so much. Thank you, Dr. Caudill. We appreciate it. So much.
And I didn't run into lunch hour. So.